The Tataskweyak Cree Nation is asking for help and has declared a state of emergency because of recent deaths and incidents of self-harm. The community of Split Lake is about 700 kilometres north of Winnipeg. About 2,300 people live there. And in a news release, the First Nation says, "We have reached a breaking point and our community is under crisis, with alcohol and drugs contributing to it." The community has reached out to mobile crisis teams and is asking for additional support from Health Canada, Indigenous Services Canada, the RCMP and the province of Manitoba. It says it needs long-term solutions, such as 24/7 in-community mental health counselling. The First Nation is also dealing with a water emergency. It's been under a drinking water advisory since 2017 and has launched a class action lawsuit against the federal government over that. Our chief political correspondent, David Akin, reached the chief of that Cree Nation. David, what else did she tell you?
Right, and that chief is Chief Doreen Spence, and we did speak this afternoon, her and two of her band counselors, and she really talked about a community that really became completely overwhelmed by a mental health crisis. Here's some of what she had to say.
Everybody's hurt and in disbelief of what's happening to our young people, and this is a wake-up call for us too, that we have to do something to help our people.
Now, as I mentioned, Chief Spence spoke to me with two of her band counselors, and they wanted to stress that the whole council, the community, very much behind this decision to declare an act of emergency. And it's for a mental health crisis, the kind of crisis they've never seen in their community before. They have 9 deaths by suicide in the last 14 months, and it is all young people, people between the age of 15 and 19. It's a community of 2,300, 2,600, depending at the time. Like many small towns, perhaps across Canada, they simply didn't have the resources to deal with this kind of mental health crisis, and that's why they have reached out for help.
We're in a desperate situation here right now. We don't want to lose any more youth, and so we need anyone out there that is willing to help our community to contact us in terms of what they can support.
Now, alcohol and drug abuse, absolutely the common denominator with all these deaths and with some continuing problems in the community, but it's more than that. Certainly the lockdowns associated with the pandemic have contributed to the mental health crisis. And that's just not in that community, but in many communities across the country. Another big contributing factor, the chief telling me today and the counselors, is the discovery of the unmarked graves at residential schools across the country. This has been a punch in the gut, not just to elders in that community, but to Indigenous youth in this particular community as well. That is contributing to the crisis. So they've reached out for help. They have some initial contacts with the federal government. They're hoping to hear more about getting more resources into the community as quickly as they can to reverse this crisis. Donna?
So much intergenerational trauma. David Akin in Ottawa, thanks. There is some support for those who need it. The Canada Suicide Prevention Service line is available in Canada 24 hours a day. The number is toll-free. You can speak in confidence. 1-833-456-4566.